Patients with relapsed refractory DLBCL have been of interest for a number of years now, given the advent of CAR T-cell therapy and more recently approved agents such as T-cell engaging bispecific antibodies. We've been struggling a bit to understand the patient population because we know that frequently patients that we've been evaluating have, up until very recently, been in clinical trials. And now as we extend these agents more and more into the real-world setting, it becomes an interesting question to understand the background population. What does the true denominator look like, and what are the outcomes in a larger patient population? So to address this, we used a population-level database in the province of Ontario, Canada, where we can look at everyone with relapsed or refractory diffuse large B-cell lymphoma that had developed progression and ultimately went on to second-line therapy. So in this very large data set, we tried to look at two key questions, trying to understand time to progression after frontline therapy, as well as layering age on top of that to better understand the risk profile and outcomes in this patient population. Not surprisingly, older patients tend to have poorer outcomes and potentially experience less treatment given age, fitness, and comorbidity. I think the other key point is, not surprisingly, time to progression remains a very important factor when predicting overall survival. And again, patients with early progression tend to experience unfortunate early death events as well. Looking at this baseline, we were able to look at this over an era where, at least in Ontario, there had been little exposure to more novel therapies such as CAR T-cell or bispecific antibodies, but we also did get a signal that even from a population level perspective, there is benefit for patients receiving CAR T-cell therapy. So this is the first, I think, of many analyses that will be done, particularly from Canada, trying to examine the impact of these novel therapies and how better to understand and to use them as we move forward in this new world of new T-cell based therapies in aggressive lymphoma.